Welcome to Families Recover Together, a three-part series on stimulant use disorder, brought to you by the North Country Health Consortium's Petra Direct program. This is part 2, Understanding Treatment and Recovery for Stimulant Use. In this presentation, we hope that you will learn what recovery is, how to assist in recovery wellness, and relapse prevention planning. Better understand the recovery pathways, and better understand treatment options for stimulant use disorder. Let's begin with understanding recovery. Recovery is defined in many different ways, but the Substance Abuse and Mental Health Services Administration defines recovery as a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. The easiest way to understand recovery is to understand what it looks like and its impact on people. For a moment, I want you to imagine that you are a pie plate. Many aspects of our lives play a role in who we are as a whole person. This is what fills our pie plate. These are often things such as family relationships, friendships, education, employment, living arrangements, hobbies, interests, and so much more that make up who we are. Somebody in active use has a different-looking pie plate. The pieces of their pie center around substance use, such as the substance of choice, relationships that are dependent on use, funds for access to substances, living arrangements based on acceptance of use, hobbies and interests that are related to use. These are the pieces of their pie that make them whole. Recovery often requires an empty pie plate, and this is because the things that made them whole centered around their active substance use disorder. So they are starting from scratch. And this is one of many reasons that recovery is so hard. So how can you help? One way we can help is with recovery wellness and relapse prevention planning. Recovery wellness planning is like creating a blueprint for living a better life in recovery. It often includes motivation for making this change, goals, action steps, obstacles, plans to overcome obstacles, identified supports and strengths, and steps to prevent relapse. You can help the person that you care about in their recovery journey by helping them create a recovery wellness plan. You can find plan templates on www.askpetra.org and from many other recovery supportive resources. You can also create your own plan. You must understand that this plan belongs to the person in recovery. It is not your plan, so it is up to them to craft it. They should write and keep their plan because they are responsible for adjusting this plan as needed. Relapse prevention planning is often included in recovery wellness planning, and it is an important step in preventing reuse. Relapse prevention plans may include plans for prevention, identified triggers, a plan of action for when faced with craving and triggers, identified supports to lean on, and coping methods for handling emotions. By now, you are probably wondering what you can do to support someone in planning. Your role is simply to support them, and this can be done by being familiar with their plan, understanding recovery pathways, offering suggestions, remaining patient, providing resources, and helping to make connections. But remember, this is their plan. Understanding recovery pathways is an important aspect of supporting someone that you care about. Recovery is a deeply personal experience. and there is no one-size-fits-all approach. There are many ways that a person can engage in recovery, including clinical pathways, personal pathways, recovery supports, and recognizing that relapse can and often is part of the process for many. Understanding these pathways can make a difference. This image shows recovery pathways in a simple format. You will notice that it has broken recovery pathways into 4 separate quadrants and placed emphasis on the fact that this person can combine pathways and move fluidly through them as they discover what works for them. Recovery support pathways include mutual aid groups such as AA, Alcoholics Anonymous, NA, Narcotics Anonymous, Smart Recovery, and many more. Recovery coaches provide support, encouragement, validation, accountability, and empowerment. Recovery centers are peer-led services usually accessible through brick-and-mortar establishments that employ recovery coaches. Recovery housing is a supportive, substance-free living environment. Recovery-based education provides support for relapse prevention and lifestyle management. Last but not least, social and recreational recovery is substance-free interactions and recovery-supportive social media. Personal recovery pathways include personal growth, which is a self-guided improvement and can be found in hiking, yoga, creativity, and anything that brings you joy in recovery. Service to others, simply defined as giving back, is volunteering, sponsoring, and mentoring others in recovery. Harm reduction simply reduces the risks associated with substance use. And abstinence is the choice to remain free of all substances. Clinical recovery pathways are those that include some form of clinical treatment, such as medication-assisted treatment, also known as medication-assisted recovery, which is the combination of behavioral health and medication treatment for initiating and sustaining recovery. This form of recovery pathway is guided by a physician. Residential treatment is inpatient treatment for substance use. Outpatient treatment is an individualized, non-residential approach to treatment, and intensive outpatient treatment, known as IOP, is conducted individually and in a group multiple days per week with a higher level of accountability. The detour pathway is simply recognizing that relapse or reuse can be an important part of the recovery journey for some. Relapse is a setback of continued use. As long as a person survives their relapse, it can become an opportunity for continued recovery. At this point, you are probably wondering what treatment options are there for stimulant use disorder. So let's explore them. There are options for treating stimulant use disorder. Many people in recovery for stimulant use disorder have benefited from counseling and behavior change models, medication-assisted treatment, withdrawal management, and inpatient treatment. Counseling and behavior change models include contingency management, motivational interviewing, cognitive behavioral therapy, community reinforcement approaches, and counseling for mental health. Contingency management is an incentive-based treatment option in which a person receives small rewards for reaching goals. Research shows that contingency management is one of the most effective treatments for stimulant use disorder. Motivational interviewing helps the person to identify the changes that they want to make, as well as their motivation for doing so, and what fears they may have related to making changes. Cognitive behavioral therapy, known as CBT, helps the person to identify patterns of thought, behavior, and emotions, to learn skills to change unhelpful patterns, cope with cravings, and resolve high-risk situations. Community reinforcement approaches increase positive activities that compete with substance use. It is similar to CBT because it helps the person build skills to cope, problem solve, and improve relationships. Mental health counseling can help with depression, anxiety, trauma, and other issues often seen with stimulant use. Medication for stimulant use is not widely available because there are no Food and Drug Administration approved medications to treat stimulant use disorder. Still, there is some evidence that some mental health medications and other forms of medication for substance use can be helpful for some people. Medication may not be right for everyone. If someone you care about is considering medication for stimulant use, they should talk to their healthcare provider. Withdrawal management, known as detoxification, provides a structured break from stimulant use for that individual to get through the early withdrawal symptoms. Withdrawal management can help the brain and body begin to function better. This is not considered a long-term treatment option, and many people will need ongoing help to cope with cravings and learn new patterns of behavior. Inpatient treatment is not a one-size-fits-all model. It requires different levels of care. Level 3.1 is a 24-hour, low-intensity treatment in a residential setting. This applies to adults and adolescents. Level 3.3 is 24-hour, population-specific, high-intensity residential services. This is designed to stabilize imminent danger among people with cognitive disabilities or other impairments. This applies to adults only. Level 3.5 is 24-hour, medium-intensity residential services in a residential setting. This is designed to stabilize imminent danger among people with cognitive disabilities or other impairments. This applies to adults and adolescents only. Level 3.7 is 24-hour nursing care in an inpatient setting with an available physician. People usually require medication and have had a recent experience with an inability to complete a withdrawal management program. This applies to adults and adolescents. Level 4 is 24-hour nursing and physician care for adults and adolescents with acute levels of intoxication and/or withdrawal potential, and people with medical, emotional, behavioral, or cognitive issues. For more information, resources, or to schedule a presentation, please contact Ask Petra. Thank you for your participation in this webinar, and congratulations on taking this step to understand treatment and recovery for stimulant use disorder.